Good afternoon. My name is Leslie Crawford. I'm a professor of medicine and the chief of the Division of Rheumatology and Immunology at Vanderbilt University Medical Center. Along with my colleague, Dr. Kathleen Sluka, I'm a co-principal investigator of a very exciting study called FM-TIPS, or Fibromyalgia TENS in Physical Therapy Study. With this brief video, I'd like to introduce you to the target of our treatment, fibromyalgia. The goals for this presentation are first, to recognize fibromyalgia, secondly, to understand who is at risk and why, and thirdly, to talk about current management strategies and how TENS might fit into the management of fibromyalgia in the future. So fibromyalgia is a condition that's associated with widespread pain. Patients will oftentimes complain that they feel pain everywhere, all over their body. And the pain is quite difficult for patients to precisely localize. It tends to move from site to site, and the pain descriptions are variable, anywhere from throbbing and stabbing to burning and tingling. Associated with this perception of pain is tenderness. And not tenderness to painful stimulation, but tenderness even to soft touch or a squeeze of the arm. In some of the research classification criteria, this tenderness is quantitated of pain with soft palpation or medium palpation in these tender points that are marked in black on these mannequins. This is actually not required to diagnose fibromyalgia, but is certainly a symptom that most people experience. People with fibromyalgia often have other symptoms that can be equally as disabling as the pain. This includes disabling fatigue, cognitive or thinking difficulties that may interfere with work or life, problems with sleep, falling asleep, staying asleep, and waking up not feeling refreshed, and feelings of depression or anxiety. Now, people with fibromyalgia oftentimes have associated conditions, particularly discomfort or pain in the muscles and joints. Some of the most common associated problems are spine disorders, arthritis in the neck or the low back, problems with degeneration of the discs and scoliosis. Whereas in the general population, fibromyalgia occurs in about 2% of the population. People with inflammatory arthritis, like rheumatoid arthritis, or connective tissue disorders like lupus, can have fibromyalgia 20 to 30% of the time. In younger people who have fibromyalgia, joint laxity or hypermobility is common. People may have been told they're double jointed. Other triggers include musculoskeletal injuries like whiplash, bursitis or tendonitis that often occurs as a result of repetitive strain injury. Are there other risk factors? Yes. People with fibromyalgia may have a long personal history of pain, experiencing such conditions as migraines, temporomandibular joint disorders, irritable bowel syndrome, menstrual or pelvic pain disorders. People with fibromyalgia often identify a family history of pain, and this identifies to us that genetics plays a role in pain, and this is quite well known both in animals and in people. People may also have a history of depression or anxiety, and that's because some of the genes that are important for pain are also important for these mood conditions. We often identify that people have a history of a stressor or stress in their childhood or current psychological or social stress. So I've talked about what fibromyalgia is, how you identify it, and who's at risk. But let's get down to some of the basic science of fibromyalgia. We call fibromyalgia a nociplastic pain syndrome. And this is pain that arises from changes to pain transmission and perception, but does not require clear evidence of tissue or nerve damage causing the pain. Now, when we think about pain and pain transmission and perception, it's useful to understand how the pain system works. The nerves that innervate the skin and muscles and bones interact with second neurons that live in a structure called the posterior horn of the spinal cord. When these nerves in the spinal cord are activated, they transmit signals from the spinal cord up to the brain, which is where pain is perceived. And a number of different areas of the brain are involved. And these include areas of the sensory cortex, which tell you where it hurts and how much it hurts, and structures in what's called the limbic nuclei, which tells you that pain is very unpleasant. In people with fibromyalgia, there's increased pain transmission and perception. And this is associated with not only the experience of pain, but the appraisal of pain, how one behaves when you have chronic pain, and how chronic pain impacts on social roles and responsibilities. The other things that happens in people with nociplastic pain disorders is that the normal system that feeds back to tamp down pain in this dorsal horn of the spinal cord is dysfunctional. So people with fibromyalgia and other nociplastic pain syndromes have a failure of this modulation of pain. So to conclude, people with fibromyalgia and other nociplastic pain syndromes have increased transmission and perception of pain and decreased modulation of pain, which results in a whole host of alterations in the way pain is appraised and how it impacts on daily functioning and every aspect of life. Fibromyalgia is managed in a number of different ways. The most recent recommendations from the European League Against Rheumatism has two overarching principles. The first is that optimal management requires prompt diagnosis and assessment of pain, function, and psychosocial context. It's also true that recognition of fibromyalgia must be as a complex and heterogeneous condition, and gradual approaches to treatment are very important. Secondly, the management of fibromyalgia should aim at improving health-related quality of life, balancing the benefits and the risks of treatment. Very importantly, the initial management should focus on non-pharmacologic or non-drug treatments. So what are the non-drug treatments that are known to be important or effective in treatment of fibromyalgia? Aerobic and strengthening exercise, cognitive behavioral therapies or changing how one thinks and behaves in relation to chronic pain, multi-component therapies that incorporate both exercise and cognitive behavioral approaches, some defined physical therapies including acupuncture or hydrotherapy, meditative movement therapies like Qigong, yoga, and Tai Chi, as well as mindfulness-based stress reduction. And we have shown in our research group that TENS is a very important and effective treatment for fibromyalgia. One can also use drugs or pharmacologic strategies, and the ones that have been recommended by EULAR include amitriptyline or Elavil at low doses, and caution should be observed in people that have heart disease or older people. Duloxetine or Cymbalta and a related medication called milnacipran or Savella are recommended. These are drugs that are important in pain processing, but they are also antidepressant drugs that target serotonin and norepinephrine, which are very important molecules that control both pain and mood. Tramadol, which is a pain medication, pregabalin or Lyrica, gabapentin or Neurontin, which are medications that decrease the excitability or increase transmission that we talked about earlier, and cyclobenzaprine or Flexeril, which is a muscle relaxant medication. Unfortunately, side effects from these medications are very common and they're often poorly tolerated. So the study called FM Tips aims to answer the question, does adding TENS to physical therapy improve outcomes in people with fibromyalgia? Additionally, does TENS help to maintain the benefits of physical therapy if you continue to use it after your PT treatments have been completed? And finally, can adding TENS after you complete physical therapy add benefit to people with fibromyalgia? We're very excited about this study and look forward to working with all of you to answer these very important questions. Thank you very much. And the contact information for our study is fmtipsstudyteam@gmail.com. And please go to our website, www.fmtips.org, for more information about this study.